They are your exclusive local experts in orthopedics and sports medicine and rheumatology.
OSMS has become the largest rheumatology practice in Wisconsin.
And that means an increase in treatment access, which is good news for patients seeking relief from painful conditions.
Good morning, Local 5 Live. My name is Lauren. I'm from OSMS, and today I'm joined by Dr. Paul Utrie, a rheumatologist at OSMS. Dr. Utrie, thanks for joining us today.
Thank you for having me here. This will be very informative.
Yeah, of course. I'm excited to have you share all of your information. So, of course, one of our service lines at OSMS is rheumatology, and we actually just became the largest rheumatology practice in the state of Wisconsin. We have 10 rheumatologists. So, can you first explain what does this mean for us having all of these physicians join us, and what does it mean for our patients?
Yeah, well, honestly, my first thought is that I'm really proud of the fact that we have been able to bring rheumatologists into Northeastern Wisconsin, into the communities of Northeastern Wisconsin. The fact that we have now brought in 10 rheumatologists, people who are here to stay, is a proud moment because, A, we were able to do it, but it also means that we have a very healthy work environment, a very healthy practice environment, and it means that there are going to be rheumatologists in our communities, not just today, but tomorrow, right? We're building for the future, but we're also building for the present moment. What does it mean to patients? Look, the biggest difficulty that any of us have medically or as patients is getting access. It's getting in to see someone when we need them in a timely fashion. It doesn't matter what your definition of timely is. We've all been in situations where the wait just wasn't reasonable, didn't seem reasonable. The bigger we become, the bigger numbers we bring in, the better access we have to serve the people that we're here to take care of, because that's really what it's all about.
Yeah, absolutely. It's all about getting people back, and we're happy to provide that at a quicker pace for people. So within rheumatology, one of the services that we offer is infusions. So can you explain what infusions are and why they may be necessary for some patients?
Yes. So in a nutshell, infusions are medications, right? It's just a different way to deliver a medication. So traditionally, we think about medications as being pills that you take. But over time, and really beginning about 25 years ago, our ability to treat people became much better because we were able to target specific types of medical conditions in a very, very specific way as opposed to a very general way. It's given us new tools in our toolbox. But infusions, again, they're medicines. Why are they different? They're different because these medications that we use to target autoimmune disease are trying to enhance parts of the immune system that are now dysfunctional, not working right.
What are some of the conditions that we are treating with infusions with that medication?
In almost every case, the conditions we're treating have to do with a dysfunctional immune system, right? So the general term we use is autoimmune disease. These are conditions including, but not limited to rheumatoid arthritis, psoriasis, psoriatic arthritis, lupus, gout, scleroderma, muscle conditions, autoimmune muscle disease. So it's pretty much a broad array of things that we target in terms of the diseases that we treat.
So what then are some of the benefits that patients can find when they're getting their infusions done with OSMS?
I think first and foremost is convenience. The people who work in our building are friendly faces, they're familiar faces that people become accustomed to over time, and those are important relationships. Secondly, is the fact that there's always a physician on site. Most facilities that are hospital-based use facility fees as a cover charge to come in the door. You see this when you're in emergency rooms, you see this when you're in infusion centers. That's something that we have elected to forego because ultimately at the end of the day, it lessens the cost of doing business here.
Great. Well, thank you for taking the time to explain all of the information you have today. If anyone would like to schedule an appointment with Dr. Utrie at OSMS, you can do so by giving our office a call at 920-430-8113, or you can learn more online at osmsgb.com.